Okay, so welcome to another episode of Med Talk. We bring various experts from medical, mental, and oral health and other healthcare providers to discuss current topics and some of the chronic disease and how to manage them, and most importantly, how to diagnose earlier and intervene and prevent getting complications and live healthy life. So during the current public health crisis with COVID-19 pandemic, it looks like our lives has been placed on pause and we are living in a different world where social gathering, social practicing, shaking hands, and hugging all are restricted in some manner to prevent getting the virus to us and getting sick. And that is the bitter truth for all of us right now. Today we have special guest with us, Dr. Hetal Gor. Dr. Gore is a board certified OBGYN practicing in Englewood, New Jersey. She has her own medical talk show on ITV since 2010. She has won multiple awards for her professional and community involvement, both medical as well as the community side. Dr. Gore has authored multiple articles on WebMD and peer journals. She was very instrumental in starting free health screening health fairs in Bergen County and part of the non-profit and charitable organizations in her local areas. She served as the medical director and owner of Better You Medical Spa, CEO of Health Media LLC, and medical director of Women's Own OBGYN. She sits on New Jersey's statewide advisory commission on minority and multicultural health and also the president and founder of the US chapter of Federation of OBGYN Society of India. Welcome, Dr. Hetal Gor, to Med Talk.
Thank you, Dr. Tushar Patel, for having me.
So let me tell our viewers that besides a frontline medical provider, community OBGYN, very involved healthcare provider, and a community activist, Dr. Gore went through the pain of getting COVID-19 herself and lucky enough to fully recover from it and willing to provide some insight to what exactly happens when someone gets sick with the symptoms. So let me start by asking you a question, Dr. Gore. How are you feeling now?
Thank you. I'm much better. Most of my symptoms, which are fever and cough and shortness of breath, have subsided for a few days now. What is left is weakness, like you feel very exhausted and tired, but I'm back to work because we are in short staff for physicians. We are needed in front line, so I'm back to work. Thank you.
Yes. So very important question for me and my curiosity as well. When did you suspect that you have or you were positive with COVID-19? What was like it when you started getting the symptoms?
Right. So as you know, we have been talking about COVID since February, during various TV as well as radio interviews, etc., to kind of let our viewers and our public know about what they should look for. So luckily, I've been on top of, this COVID-19 pandemic, what are the signs and symptoms. But we hardly knew about actually before developing fever and all what happens, right? What we call as prodrome syndrome, where before you develop all the symptoms, there are certain symptoms which can give you a hint, right? That can, so I felt for a few days very tired, very exhausted, and I couldn't figure out why, because that's not like me. I really wanted to sleep and felt tired. So I thought maybe, I'm coming down with flu or something. I didn't even think I had COVID because that was never discussed before. And then I had little diarrhea, little nauseous, and I lost taste in my, like I couldn't feel the food. So I'm like asking the kids, I'm like, oh, did I not make it correct? No, it's fine. Everything is perfect. So that was another thing which was very little out of the way. So first for 2-3 days, I felt weak and tired. Then I had diarrhea and nausea for a day or two, and then I lost taste. So total of 3 to 5 days, I didn't feel 100%, but I still could not tell that it was COVID. Finally, then I got fever and cough and shortness of breath. And luckily, I do surgeries also in my office, so I had all this monitoring that is available to me rather than go to the
Yeah.
hospital. So I got all those monitors at home. I monitored my pulse ox, I monitored my pulse, my blood pressure, and I figured, and the vitals were completely out of the whack. My temperature was 102, my pulse was 142, 143. Just to give our viewers, like, our temperatures are supposed to be 96, 97. Mine was 102. The pulse is usually 80s, and my pulse was 142. My saturation, my pulse ox, was, instead of being at 9900, was at 91, 92. And I just couldn't breathe. I felt like I was like asthmatic, gasping for air. We've read as a medical professional all the symptoms of, but to feel it firsthand was really, so that's when I got the fever, shortness of breath, and cough, and all my, temperature and vitals were abnormal. I put one to one together, and I could say that I had COVID.
So when did you get your first symptom from the initial lousiness feeling and initial diarrhea and stuff? When did you start getting that fever and uh,
So
tachycardia
as I
and all
said, it's
those?
anywhere
Yeah.
from 3 to 5 days, anywhere from
Okay,
3 to 5 days from the starting of, feeling not too good. So
that's good.
that's the first time I then put one to one, and I'm like, yes, this is COVID. And so then I, of course, isolated myself. I self quarantine. I had some medication, so I started all that then.
Okay. So when you started getting fever, how did you monitor yourself? What did you do specifically for yourself?
So to be honest, I was completely not in a shape to take care of even myself. I was tired, exhausted. All I wanted to do was like lie down. I can't even say like I was completely out there. I was not drowsy, but it was very difficult. It's very difficult to explain. You are in this phase that you've been awake for thousands of days, and now finally, you're getting a rest. Or other way to describe is like you're run over by a truck, and like you have no energy, and you're just
Uh,
sitting there. So I would put an alarm on my phone to firstly check on me, because you are isolated yourself. I didn't want anybody to come in, but I was also scared that I might pass out in my sleep, like, because I was so exhausted. So I would put alarm every few hours, and that, like, I will wake up to the alarm. I'll at least take my, vitals again. I'll drink a little bit of water, because your appetite is not there. So I just had to, I would tell myself, I have to survive this. I have to make it through. So I would get up every few hours and monitor my temperature, my pulse, my, oxygenation.
yeah, yeah. So you are really sick at that point. So what treatment did you take when you had fever and when you started developing these symptoms? Did you take any specific treatment for it? As a physician, I know you must have some kind of treatment plan on your own, even though you are not in 100% sense of treating yourself.
Correct. So luckily, I was supposed to go to India to visit my mother, which I had to cancel. So I had some hydroxychloroquine that we take for malaria prophylaxis when we visit India. So I had hydroxychloroquine, and there was all these studies and some anecdotal cases about people using hydroxychloroquine and Zithromax about it. So I didn't have Zithromax with me, but I did have hydroxychloroquine. So what I did, as soon as I had the fever, I started, even though there are certain studies which have come out in New England Journal now, which are not saying that it might be effective, I do feel that the cytokine storm, as we call it, right, when the virus is attacking your
Yes.
cells and it releases this chemicals, I think chloroquine did help me with the cytokine surge. So my damage to my lungs and other organ was minimum, and I feel that's why, even though I took 10 to 14 days to recover, I still recover much quickly compared to other patients and that I'm
Yes.
seeing. So of course I took Tylenol, and I took to get the temperature down, and I took hydroxychloroquine.
So that's good to know. There are a lot of talks on natural remedies or herbal treatment. Did you try any of those natural remedies? And what were they if you tried?
So even before I got sick, since February, we were all talking. So I was trying, like anybody else, to improve my immunity. So I was definitely having every morning. I had made this with the ginger and turmeric and little pepper. And I would put it in hot water with a little bit of lemon in it, which I was drinking every day, which I did continue drinking even when I was sick, because that's the only thing I could drink was with hot water with lemon and little ginger and turmeric. So I definitely tried that. I tried steam for a day or two, but I was so weak to stand or even breathe from that. So I wouldn't say I did it for a long time. But that's the only natural thing I've done. I definitely, since I've got better, I'm trying to eat a little bit more healthier and eating, more lemon and hot water just to feel good. But I'm not sure if any of the other remedies, they're kind of like a proven. But if it doesn't harm, I would say please go ahead and do, because these are all like food related, healthy things. So absolutely there's no harm in doing it. But if you are really sick, I don't think you should just rely on natural remedies.
Yes, yes. So, we had an interview. We were in the panel sometime early March when the COVID-19 pandemic did not hit actually in the US as a pandemic. And since then, what is your advice to our viewers, especially how to avoid or prevent and what to look for in a common people who are mostly staying home, or some of the first responders, or store owners, or grocery store workers who goes to store, or bank people who goes to work. What is the best advice for those individuals on at least identify themselves if they have some kind of symptoms you had, and prevent, and what to look for? What is your take on that?
So absolutely, I think when we did panel together, Dr. Patel, and also like what I had spoken in February till now, after 60 days, I feel like things have changed a little bit, right? Things which have not changed is, of course, stay at home, physical isolation, social isolation, avoid big crowds, don't go out if you don't have to, wash your hand. But what has changed is use of mask. We told initially, please don't use mask if you don't have symptoms, because you're going to touch your face
Yes.
unnecessarily. But I think what we have observed, and even the WHO has changed, is a stand that it is not just the droplet, it's also aerosol way of transmission. That means even the air we breathe, if somebody has coughed or sneezed, a few hours back, there is still particles that we can even inhale. So I feel like anybody who's leaving the homes should please wear a mask, if not surgical mask, even make like a bandana, because lots and lots of videos from really medical sites which are coming and showing the amount of transmission when you don't have mask and when you have mask is so much different and less viral load. So I think one advice will be, firstly, don't go out of the house. But if you do have for some essential work, then please wear a mask. Also be careful where you touch. Gloves can be good or bad. You can wear the gloves, but be mindful where your hands are still touching, because sometimes you will do cross infection, right? You'll touch something and touch your face, and you are actually putting more of the
Right.
viruses on yourself. So that's the other advice compared to what we've been talking.
Very good advice. Thank you, Dr. Gore. So, what is your advice to our viewers if they develop symptoms, and what to do, when to seek help? If let's say if someone develop fever, some coughing, what do they do first? What is your advice on that?
So the testing, even though everybody's saying it's very easily available, it's still very difficult. Even for when I had symptoms and I had to get tested, it took me a few days even to figure that out and have somebody drive me, because I was not in any shape to drive. So testing is still difficult, but if you develop fever, cough, shortness of breath, firstly, what one can do is isolate themselves, right? Like try not to interact even with your family members, try to stay in one place, wash and clean any surfaces you are touching, even like your vessels, the spoons, and anywhere where you're breathing, that air should be limited to the other people. They should use mask and gloves if they are coming near you. So that's one thing they can start doing. It they can call or telemed with their primary care, telling about the symptoms, and their primary care might be able to guide them where there are testing sites. Every county has developed testing sites. If you have symptoms, you could be tested. So some physicians are having those testing swabs in their offices. So figure that out. Call your or ask your family member to call your physicians and figure those out. And if you can get tested, that's great. Keep your primary physician in the loop that you do have symptoms, and they might give you all this parameters one should look for. So, but one thing, if you don't have anything to monitor yourself, if your temperature is going high, you can't breathe, you short of breath, then please go to the nearest ER, and they can do your saturation, your oxygen level, and then they can decide if you need to be hospitalized, if you need to go to the ICU. But if you can't be comfortable in lying down and breathing, that's kind of a worrisome sign, right? That you need to
Yeah.
get some urgent medical advice.
So if someone doesn't have a primary care provider and if the symptoms are severe, they can call 911 or drive to ER. Family member can drive to ER.
The only word of advice is that if you don't have that, please expect yourself for a few hours of waiting period. What I have heard from a lot of patients as well as friends, that when they've gone to ER, they had to wait for hours before they could be seen. Unfortunately, we're trying our best to keep people going to ER unless they really are sick. So try to figure out, if you can reach out to any physician that you can get hold of and talk to them. If you can't, then maybe you can go to some urgent care, call those urgent care before that you suspect. And if you can't get hold of either your primary care or urgent care, then absolutely go to the ER. But understand, they are really overwhelmed. They are really taking care of very sick people, and you might have to wait if you are not sick. The same goes to 911. They are getting so many calls, and even for the EMS to come to you might take, few minutes or more.
So if Dr. Gaur, if someone start getting symptoms with fever and coughing and difficulty in breathing, what can they do to help their family members, and what precautions should the other family members should take so they don't get the positivity or COVID-19? What?
Absolutely.
Yeah.
So if it's possible, try to keep the person whom you are suspecting COVID, or once even it's diagnosed as COVID, and if you are monitoring yourself at home, make sure they, if possible, try to isolate them in a room, right? So if they can have their own individual bedroom with bathroom facility, that will be ideal. If you can't, then maybe send your vulnerable people from your house. So if you have elderly parents in your house, or somebody with comorbidities like diabetes, blood pressure, heart diseases, immunological deficiency, cancer, try to take those adults to either your friends or other relatives' house, so that way you're not infecting those people. So try to isolate COVID person to one room. Also, if you are interacting with COVID suspected or COVID positive patient, make sure you wear mask, right, and gloves, and keep their laundry separate, keep their linen separate, make sure the vessels they eat, the plates, the forks, the knife, the glass, everything, wash it with hot water, at least for a minute or so. That way you're killing all the viruses. So make sure you take all the precautions, clean the door knobs, the phones, the computer keypads, all those are very much likely to transfer viruses from one to the other. So all those common area that you might touch, please keep them wiped with Clorox wipe or light bleach to make sure, use hand sanitizer, don't touch your face, keep washing your hands.
So, Dr. Gaur, how do you see ourselves in upcoming months, let's say in 4 to 6 weeks from today, when the states or federal government decide to release some restrictions and open the economy back to near or new normal? Uh, do you think the testing for the diagnosis as well as the antibody is required before we put many people together, especially in New York area or the Los Angeles area where we have ghetto population? What do you suggest or what do you recommend that
So
to happen?
right, as we all know now, the stay home order has been extended to May 15th. So we almost have one more month to go before we should be able to go out. As far as gatherings, I think we should not have big gatherings even when the lockdown is out. I think
Yes.
Because there's always a scare of second surge, right? Like this thing can come again as we all go back. So I think it should be in gradual manner, the mingling of people. But I think we should restrict, even when the lockdown is off, to 20 to 25 people only initially, and then slowly. But I don't think the large gatherings, events should be done for a
It's
long
gonna
time,
happen.
because we don't know.
Yeah.
Secondly, I don't know if we'll be having that much testing available, but in ideal situation, what will be ideal will be to do antibody testing, because testing for COVID might or might not be effective, because some of us might be subclinical, immunized, correct? So we might not have had all the symptoms.
Mhm.
And COVID testing itself has 30% falsely negative. So even though I'm positive, but I know there could have been people who were positive, but the test came negative, right? So there is a 30% chance of test being negative. So I think the best way will be to do COVID antibody testing, IgG, IgM, to see if you are immune to or not. So that will be the best way for us to know, if we can go back to work, if you are immune. If you are not immune, you should still take strong precautions. So that will be the ideal way to get all the people back, say the banks, the kids back to school. Those things the essential things might start before the non-essential. Like, I
Yes.
don't think restaurants and bars should open soon, because we really can get away with that for some time right now. But the
Yeah.
essential things, like bank being open, grocery being open, and other things should open first.
So since the virus affected millions of Americans since January this year, any new developments or advances in testing, treatment, or vaccine? Can you shed some light on? I know testing, you spoke about it, but any treatment or vaccination? Do we expect anything this year, 2020, or
Unfortunately, we don't have a particular medication that we can say like it works, right? So it's unfortunately not like that. There are still lots and lots of trial going with anti-malaria tablets, antiviral tablets, HIV tablets, or HIV medications, also interleukin 6 inhibitor. They are trying plasma. There's so many different trials going on, but we don't have a treatment that is kind of approved right now that, yes, this is the treatment for COVID. Also, the vaccine for COVID is still quite not yet in horizon. People are working. I think there are 3 companies who have been approved to start developing it, but any vaccine takes a long time to develop, and hopefully the virus doesn't mutate, and that way the vaccine can be effective. So as of now, April 16th, we still don't know which medication or which protocol of the medication works 100%. We still don't know. Some medication look promising compared to the other. Plasma right now looks promising compared to the other medication, but we still have no guidelines to what is the best treatment option.
so anything else important you would like to share with our viewers, or any personal advice from your experience as one of the patients as well as a medical provider frontline who recovered fully from this COVID-19? Or any last take-home message for our viewers?
I think please continue doing what you guys are doing. I'm like so proud of so many of us who've changed the way we do a day-to-day working. Please stay home. Don't go out if you don't have to. If you do have to go out, please don't send the vulnerable people out. You can volunteer and get food or groceries for your elders or your neighbors. And when you go, just have a list with you. Try to minimize your time in a grocery store. Go with a list. Touch only the things that you really want, and keep your interaction very brief in the open places. And when you come home, please change your gloves and discard them in a reasonable fashion in a garbage can. Don't throw them around. And we'll get through this. It's just matter of time and patience. I know it requires a lot of patience. We all want to enjoy our lives, but this is the least we can do.
Thank you so much, Dr. Hetal Gor, for your time from your busy schedule to come to Med Talk. And I wish you all the best in your continuing service to our population in New Jersey, as well as getting better to yourself as well. Thank you so much.
Thank you, Dr. Patel, and thank you. And you also do a great, amazing job for all of us. So continue doing that.
Thank you. Take care.